Start the webinars. So people start joining us now. And then let's do this. Share it this way. I don't know if you could still hear it now.
Yep, I can still hear it.
Okay. So welcome everyone to the Mind Health Shop Talk. We'll get started in a few minutes. Oh, we have another Alma on the line, Alma. So welcome the other Alma: Chavez, Benjamin, Beverly, Gabriella, Keisha, Karen Baker, Linda. Welcome everyone. Richard, Shania, that's our intern from Black Mental Health Alliance. Sonia, Tasha, Taylor, Tania, welcome guys. We'll be getting started in a little bit. We're going to be talking about COVID-19 and youth mental health. And we have a new speaker tonight. We'll just give it a few more minutes. So why I chose this music, this is a chill hop, it's lo-fi beats. So it's just a little background music that's not supposed to make you stressed. It's a good music to have on when you're studying or just trying to power through a long workday. This kind of helps your mind to stay in a good positive state. So drop in the chat if you like the sound of the music. And we'll make sure we do different playlists the next time we join each other again. And we also have someone on the telephone line, so welcome. So I think we're gonna, what do you think, Alma? We can go ahead and get started?
Yes, I do.
Okay. So let me stop this music. So welcome everyone to the Mind Health Shop Talk, the Black Mental Health Alliance for Education and Consultation. We're pleased to work with Kaiser Permanente in their Good Health and Great Hair Barbershop and Beauty Salon Outreach Initiative. And it brings physical health, mental health, and social health services to West Baltimore communities. So pre-pandemic, my coworker Lynn and I would go to most of the workout sessions with Devin. We used to have a good time. But the Mind Health Shop Talk piece, the sessions are the mental health component of the program. And these forums are led by licensed mental health clinicians or someone with lived experience that includes culturally affirming mental health information, discussions, and resources. And during the pandemic, September 2020, continuing through June 2021, the Mind Health Shop Talk sessions were held virtually on Zoom. So we thank all of you for transitioning with us with that process. So for tonight, our topic is COVID-19 and youth mental health. And so for this Mind Health Shop Talk today, we're doing an important conversation on mental health after the traumatic racial experiences of 2020 and the COVID-19 pandemic. We have a therapist who's been seeing all of the concerns of parents and youth during this time. And with this talk, we want really for you to get helpful tips on maintaining mental wellness as a young person during these stressful times, and how to share with family members, friends, your teachers if you're going through a crisis, and also on the flip side, how they can help support you in a time of need. And we'll also discuss how really we want to remove the stigma of getting help as a young person. And also, I know that Alma is going to probably talk about this. Kaiser has an event coming up tomorrow in partnership with NAMI, talking all about dealing with a mental health as a young person. I will drop that registration link in the chat as soon as we do our introductions. And so with Black Mental Health Alliance, a little bit of what we do, we develop, promote, and sponsor trusted, culturally relevant educational programs, trainings, referral services that promote the well-being of Black people and their communities. And really, we have a vision that all Black communities will reach optimal mental health. And so with that in the community, we do, for community support, we do workshops, we do forums, we do educational trainings for different organization or community groups on different topics. So you just have to reach out to us to find out if we're available and what topics you would want to for us to present. And we also do a referral database, which you could usually for our BMHA members who are providers that really support and understand having a culturally affirming therapist, mental health provider. It could be a nurse practitioner, a psychiatrist. We connect people in the community with a provider. And with that big breath full of information, I just want to introduce Kaiser Permanente's regional Mid-Atlantic region. I'm sorry, I messed that up. Interim Director for Community Health for Kaiser Permanente, Ms. Alma Roberts. And she's going to be talking more about the Good Health, Great Hair initiative.
Good evening, everyone, and thank you all for joining us for such a meaningful and timely discussion. I am Alma Roberts, Interim Director of Community Health and Economic Opportunity and Impact for the Mid-Atlantic region of Kaiser Permanente, which stretches from Greater Baltimore to Northern Virginia. The Good Health and Great Hair outreach initiative works in partnership with local barbershops and beauty salons in Greater Baltimore currently, though we're in the process of expanding across the region. The idea came about from our medical group, the Permanente Medical Group, Mid-Atlantic Permanente Medical Group, as they viewed the clinical data from our and the needs data from our community health needs assessment that we do every 3 years. And there was a startling disparity in flu shots at that time, in particularly the West Baltimore area, largest disparity in the state of Maryland. And so as they began to plan how to close that gap or to at least begin to address it more directly, the idea of taking the shots and the information and the needed access to safe and trusted spaces emerged. And of course, barbershops and beauty salons were top of that list. And so we embarked on a pilot in 2016. And in 2017, we instituted this program as a signature event in our portfolio of community outreach activities. Now, some almost 8,000 folks later, the program includes physical, mental, and social initiatives. We added social supports like financial literacy. We added the outreach of community health workers, and we to our physical screenings that we were doing, a broad array of screenings that we provided. And of course, our good partners from the Black Mental Health Alliance provided the access to timely and relevant discussions impacting our social and emotional well-being. And so tonight's discussion, and as Roxana said, we had to shift nimbly as everybody else did when the pandemic hit. At least the one pandemic caused us to shift to virtual. And I reference what she also references is the dual pandemics that we've been living through. And all of 2020, when the pandemic really hit in the US, leading up to that, we were dealing with a contentious 4 years of political upheaval and racial upheaval. That led into a contentious election that resulted in all kinds of hell breaking loose and the perpetuation of violence of unspeakable levels. And then the pandemic, the disease-related pandemic, the viral pandemic, hit on top of all that, and the racial pandemic continued to accelerate. All that I say is what a hell of a lot of stuff we've had to cope with. And think of our children as they are entering puberty and dealing with all kinds of additional added stresses and peer pressures. They have had their poor minds and bodies put to the test. So tonight, there's nothing more timely than discussing how are our children. And I'm looking forward to hearing the discussion, and hopefully you all will be active participants as we take this journey together. Thank you all so much for being here.
Thank you, Ms. Alma. That was beautiful. I feel like inspired just from hearing you say all that. So I also wanted to share a video from Ms. Nia Jones. She is our youth and young adult college division director. She was not able to join us today. And she sent a video. So I want to share it. It's only 3 minutes. She's really passionate about the young people as well, and is understanding a lot of the issues that they're having, and has really worked hard to put a youth summit together. So I'm going to play the video so that you can hear what new initiatives we have upcoming as well.
Hey everyone, so sorry that I couldn't be with you in person today on this amazing shop talk that my colleagues at the Black Mental Health Alliance has prepared. But I wanted to stop by just to share some amazing things that our Youth and College Division has coming up really soon. And so for those of you who don't know me, my name is Nia Jones. I am the Youth and College Division Director for the Black Mental Health Alliance. And I consult with BMHA on a variety of other topics. But today I'm coming to let you know about 2 amazing events that we have coming up for young people between the ages of 18 and 25, and then another one for young people between the ages of 12 and 25. And so I'm going to share my screen, and so first up we have the Salo Bona circles. And so Salo Bona translates to I see you. And so these circles are aren't your traditional group therapy. They're actually not therapeutic at all. They are healing circles that the Black Mental Health Alliance will be leading in collaboration with the Recast B City group in West Baltimore. And so we are saving spaces for young people between the ages of 18 to 25 to have conversation on topics that impact them. And so our first session is next Thursday, May the 27th. For about 90 minutes, we'll have a wonderful roundtable conversation that you just don't want to miss. And then our annual youth summit. That is right, the third time's the charm. We are doing this again for young people between the ages of 12 and 25. So we will have something for our middle schoolers, for our high schoolers, our college students, those who are in trade programs or want to be in trade programs. And so our annual youth summit's theme this year is Black Brilliance, Black Wellness. It will be 100% virtual, but our theme is up close and personal. And so our young people will be able to see some amazing Black people doing some amazing things for our community. feel free to get involved. We're looking for sponsors. We're looking for presenters. We're looking for people that just want to volunteer and support the work that we're doing. So definitely feel free to reach out to us. Roxana can put my email address in the chat. We look forward to meeting all of you real soon. And so thank you so much for attending today's event. And definitely follow us on Instagram at Young Black Minds Matter. You can also visit our website, www.youngblackmindsmatter.com, and Black is spelled BLK. And so thank you so much. Have a great evening and be well.
Yep. So thank you guys for taking time to listen to that. I'm really excited about the opportunities that we've had to really help heal our young people and encourage them. So I definitely wanted her to be able to speak on that behalf. But for our featured speaker tonight, I know he is excited to get this information to you as well. Mr. Sean Baker, he is a licensed clinical professional counselor. He received his bachelor's degree in psychology from Winston-Salem State University and his master's degree in clinical mental health counseling from Trinity Washington University. After receiving his bachelor's degree, he worked in a residential program for adults with chronic mental illness. And then that's what made him shift his focus and begin working with children in 2014 at Lighthouse Center for Therapy and Play, LLC, doing play therapy and family therapy, which is, I remember distinctly when Ms. Mimi Ryans was speaking about this dynamic young man that was interning with her and she ended up bringing him on full time. So I'm so excited to see and hear about the work he's doing with her. He also has worked in 2 Prince George's County public schools as a student advocate and as a mental health consultant. And currently, Mr. Baker is a military family life counselor working with children and families at Joint Base Andrews. A short but powerful quote from Frederick Douglass motivated him to shift his focus to working with children. It is easier to build strong children than to repair broken men. And that's by our Mr. Frederick Douglass, a powerful quote. Wow, Sean, you got to tell us about what made you shift, especially working with the adults who really need a lot of support to our children who really need a lot of support.
So thank you, Roxana, for that amazing introduction. To answer your question, what made me shift really was to see how children a lot of times go without the services and the early interventions necessary. And when that happens, when they get the early intervention, we can hopefully, fingers crossed, we could alleviate or kind of diminish the need for adult interventions. So basically, to catch it soon, catch it early. And that way we can help on the front end instead of trying to help on the back end, when in some cases it becomes too difficult to reel in.
And so with that, I'm going to allow you to share screen, and I'm giving the baton to you.
All right, sounds like a plan. So let me pull up, I have a short PowerPoint for us, and then after the PowerPoint, we can get into questions. All right, so let me, so like everyone stated earlier, this presentation is going to be about mental health and COVID-19 and youth and mental health in particular. So making it a priority during the pandemic, which has been, a struggle for all of us in so many different ways. Pandemic has definitely affected everyone in some way, shape, or form. So hopefully some of the information I give today and, different things in your life that can lead you towards being a better you. So just to kind of jump in quickly, I have a few statistics, and then after these, we're going to get into some specifics about youth statistics. So as you can see, nationwide, almost 1 in 5 people, that is an astronomical number, in the US are living with a mental health condition. And more than 500,000 people have reported signs of anxiety and depression within September. So this is, imagine the start of the pandemic, which most of us, equate to March of 2020. And going through September of 2020 is when this data was compiled, collected, and went through by Mental Health America. So that is not that long, almost a year, but over 500,000 people reported anxiety and depression. That's highest it's ever been. And also, again, between April, so shortly after the pandemic started, and September, 70% of the people reported loneliness or isolation. Of course, that's due to, how the whole world pretty much shut down on us and we all had to do everything virtual. And it has really changed the way we interact, the way we live, and trying to adjust to that takes a lot of time. So please be patient with yourselves, but also push yourselves outside of your comfort zone. So again, like I said, we're going to get into some youth statistics. And so as you can see, suicidal ideation, right at the top, we're going to get right to it. That's one of the things that a lot of families, a lot of children and youth in particular deal with, and they deal with it in silence. So that's why we have to be very vigilant. So in September of 2020, over half of 11 to 17-year-olds, so you have middle school up through high school, 17-year-olds reported having thoughts of suicide or self-harm. And a lot of times, folks, even if they came to the adult in their world, the parent or guardian, it's something that is frightening. It's a phrase or statement that, they make, and then their parents or guardians kind of freeze. And it can be almost a numbing feeling. But since it happens so often, over half are reported having these thoughts. We just have to be prepared and know exactly what services or what supports we can lean on when need be. And I think that's going to be very important for parents to be, informed and vigilant and paying attention to their youth and their kids and what they're doing and how they're interacting with others and things of that sort. And again, this is a higher rate, especially with youth who are consider themselves in the LGBTQ community. It is actually something that they have to be more vigilant about. And then two, to add another layer to this, students who identify as more than one race also have a higher rate of depression. As you can see, it's about 12% of youth in the US. And then 10% of kids in the US or youth in the US have severe depression, and that's just what is reported. So yet again, I'm giving you these numbers just to give you an idea how much it's impacting us, but also keep in mind that these are the numbers that are reported. There's so many that are going unreported and not diagnosed that we are missing out on. So, and then to kind of segue a little into the adults, because we have to keep in mind the adults in the world, because without the adults, the kids, they need that constant support. They need that consistent support. And our adults, we have to take care of ourselves as well. So 57% of adults with mental illness receive no treatment. 60% of youth with depression do not receive any mental health treatment as well. So we have to, once we realize there's an issue or once we realize there's a struggle, we want to try to reach out to get help or support in whichever way you feel is necessary. And then to come to Black people, 63% believe that mental health is just a sign of personal weakness. As a result, people experience shame about having a mental illness. That is a terrible stigma that has to go away. And it's something that we all have to collectively work on to lessen that negativity, because it's nothing wrong with reaching out for help. It's nothing wrong with asking for support when needed. And I think that that's something we have to shift into, and we have to change our mindset. And especially with going through, this pandemic, I think it's important for us to realize when we need help and be able to communicate it effectively and ask, because if we don't, you can truly suffer in silence. And with the world being a lot still virtual, yes, things are opening up, but with a lot still being virtual, people, it's easier for them to isolate, and it's easier for them to to lock themselves away. So that's why I wanted to share some of these statistics with you guys, just to give you a snapshot into how much this is affecting us. And these are all numbers from just 2020 alone. So with that being said, we're going to move into, let me get my PowerPoint working. We're going to move into warning signs. So a lot of times parents will ask me, and towards the end of the session, or when they get a moment when their kids aren't around, they'll say, well, Mr. Sean, what exactly do I have to look out for? Because, such and such, I just don't know what to look out for. And I tell them, kind of look for some of the obvious things, but also look for some things that might be out of character. So when I say some of the obvious things, kids oftentimes, and youth, oftentimes report headaches, or my stomach hurt, or you'll hear them sometimes say, I just can't sit still. I don't feel like doing this. I have to get up and move, sometimes with our high school students. But also, those are things that could be attributed to anxiety, worry, nervousness, scared about the future. So it's a lot of things that some of those physical symptoms that seem just everyday normal, some of those physical symptoms could be signs of something bigger. And you just want to pay attention to them. I'm not saying to diagnose your kids the moment they say, oh, my stomach hurts, but it's just something to be mindful of if it's continuing to happen. And also, a decline in grades is a big, one that parents quickly, notice. And also eating and sleeping habits. Oftentimes, when you're nervous, eating habits may dwindle down, or they can ramp up. It just depends on the person. So if those eating habits go one way or the other, that's something to look out for. And sleeping as well. Sometimes people have insomnia. Kids oftentimes are now taking melatonin to help them sleep, and different things of that sort to kind of work through some of these nervous things, some of this anxiety, some of this depression. And of course, you have to, again, be vigilant and be paying attention in order to catch those things, because sometimes parents may think, oh, it's just, it's not that deep, it's not that big of a deal. But sometimes if it's consistent, or it's messing up a child or youth's daily living skills, where they can't do their normal life routine, then that's when you really want to kind of jump in there and figure out what's wrong, and always leave the lines of communication open. I think sometimes youth, it's important for them to literally hear the words, you can come talk to me when you're ready, and giving them the green light. You give them the green light to talk to you. Some of these warning signs can go away because they feel that they've gotten it off their chest. They have an ally, they have a support, someone to add to their circle. And that's really important. Another big one is lack of motivation. And a lot of times in working with boys in particular, lack of motivation is a big one. And I'll get parents come and say, Mr. Sean, he's just not motivated. I don't know how to get him motivated. His grades are slipping. And I have to ask, like, what are some of his, usual activities? What are things he likes to do? Kind of going back up to the point at the top of the slide with favorite sports and hobbies, because sometimes you can use those things as a motivator, and sometimes you can use those things to say, as a gauge, to say, well, maybe he's not as engaged for a reason. What life changes have happened? And it can make you kind of reflect a little bit and say, has there been any family changes, any schedule changes, any new things come up that might have, this kid kind of thinking on terms of how to fix things, or makes this kid worry. So those are things to, again, like I said, be on the lookout for. These are some warning signs. And irritability is another one I want to hit on too. Sometimes kids can be super irritable, and it might not be because they're hungry or sleepy. They may be irritable because they constantly have something that they're thinking about, and their brain is occupied. And then when someone asks them to do something and it takes them away from what they're fixated on, it becomes an irritation. So again, that's something to be mindful of when you're interacting with your youth and kids. So coping strategies for some of these things. And these coping strategies, I kind of put them together to be mindful of the pandemic, but also try to create a bit of normalcy. So control what you can control, which is why I said, we have this pandemic situation. We have a lot that is still virtual. Although some things are opening up, people still may not be comfortable with it. So control what you can control and let the rest go. Do what fits for you to create some sense of normalcy, some sense of a routine, because we can't stop, the world, we can't stop others from doing what they feel they want to do. But what we can control is what we do and how we do things. So, in order to create your own sense of normalcy and peace, you definitely want to be mindful of what you can't control. The moment we worry about what we can't control, then we kind of feel stressed. And that's kind of what breeds stress, is worrying about things beyond your control. And again, stay connected. Once you have that routine or schedule established, stay connected to other people, whether it be text, calling, social media, Zoom, what have you, whatever works for you. I know a lot of youth, a lot of my teams I've worked with, they love social media, and that's how they keep in touch with one another. Of course, as we all know as the adults, and they know it as well, social media can be a blessing and a curse at the same time. So it's just properly using social media and being mindful of what you take in on social media and what you ignore. Sometimes we have to hit the unfollow button if we're feeling like this page or this person's post is affecting us negatively. It's okay to unfollow if it allows you some peace in your life. And it's also okay to communicate and keep in touch with people via social media. Yes, it has its pros and cons, but we want to use it for the positive things as much as possible. And it's easy for us, to fall into the trap of the negative things and to get caught up in drama and things of that sort. But again, social media has so much to offer. You hate to just completely nix it out of your life because you want to stay connected to other people. Again, being mindful of negativity, including, the media you take in, whether it be, someone who loves to watch the news or things of that sort. You just want to have a nice balance. Make sure what you're watching on the news is you getting your information, you're informed, but you're not too informed to where it's having a negative impact on you and making you scared to, live your life, or making you scared to interact with others and things of that sort. And again, every activity you decide to do, whether it's something that makes you happy, whether it's something that's make you laugh, it's something that you need to be mindful of and add to your self-care plan. You have to engage in self-care activities because we're going to go through stress, we're going to be tired, we may feel burnt out, but at the end of the day, if we make time for self-care, then we can refuel ourselves. And if anything this pandemic has taught me and personally, is you have to invest in yourself and take time for yourself in order to help others and in order for you to keep going. So some of the self-care activities I have here is cooking, reading, exercising, DIY projects, and journaling. A lot of those things are everyday things, but for some people it takes a lot to pick up a book and focus for that, let's say hour of reading, because it's easier to just click the remote and watch TV. Sometimes you want to do something different, something that mixes up, again, going back to balance. You don't want to have too much of anything. You want to have a nice balance. So again, for me personally, cooking is one of my favorites. I love to grill. If anyone who knows me personally, that's usually what I'm doing on the weekends, practicing something, using a new recipe. Um, Again, and journaling is another one I have picked up. It has been something that I have had to push myself to do. And again, self care sometimes includes things that are good for us, even though they're not our normal everyday thing. So, journaling is something I have to really make an effort to do. And I'm actually in the process of working on a self help journal. And as you can see, the Instagram page below is Just Pub. So, Get Your Stuff Together Publication is a Black owned publication company. And we're working on a journal, hopefully, help people foster positivity and shift their mindset. And Our subtitle for the journal is "The Proper Perception Produces Positivity and Peace." And we want people to have a sense of peace. I think that's so important, and being mindful and finding your own peace, protecting it, and being aware of what impacts it. So that's how you make sure your coping strategies are useful. When you know what impacts your mental health, you know what's affecting your peace, and you're able to redirect it, figure out a way to regulate your emotions, and do things that help you shift back into a good headspace. So those are the coping strategies you want to try to use. There's a ton more. I couldn't possibly cover all the coping strategies that are out there, but I just wanted to name a few that are, really helpful and kind of in your face that are easy to implement. So to get into some resources, I know these are a lot. I see a lot of links here on the page, but trust me, everything here is something that you could take something away from. Each resource is great in its own right. So at the top, you see I have NAMI and Mental Health America and Center for Disease Control. Those three, you can get a lot of information, but also they have resources and tools such as questionnaires or things that you could take, like little surveys, to figure out, really, am I definitely in need of professional help? Is my child in need of professional help? And if so, how can I find people? How can I, utilize my health insurance? Or is this particular practice going to be open due to, COVID numbers? And if this place is open, what's the capacity and things of that sort? So you can kind of map out where you want to go, what you're comfortable with, and if it fits your budget as well. So those websites have some great resources. Again, my favorite thing from those are the wellness tools, where you can check in, do a little short test just to see, like, maybe is this something I want to venture down? Is this something I want to look into? And it gives you a better picture than, sometimes if you're a type of person who loves to Google, you may get on Google and you say, oh, my back hurts. And then you get on Google and you quickly realize that Google's telling you, oh, you have terminal illness and you're upset. So now you've gone too far, you're in the rabbit hole. So we don't want to get you there. We don't want you diagnosing yourself with everything. But we do want to make you aware, like, hey, this is a little off for me. Let me check in about it, you know? And then after that, my fourth point here is Lighthouse Center for Therapy and Play. I currently am there and I'm seeing quite a few folks at Lighthouse. And I'm doing virtual right now. And a lot of other therapists are doing virtual, but some are doing hybrid. So definitely check out Lighthouse if you're in the Howard County, Columbia area. Is a great, obviously, I'm a little biased, a great therapy practice, and people there, the therapists, the staff are just phenomenal. Again, the next one is Resilient Child Therapy Institute. They are located in PG County, which actually they're in Largo. So that's kind of like central PG, closer to Bowie. And so they're like central Prince George's County. I don't know if we have any listeners or anyone on who's in that area, but also dedication counseling and unstuck counseling are also in about central Prince George's County. But what I do know about those three, if you're outside of the Prince George's County area, they do have an option to do virtual counseling. You just have to inquire about it and see how that can work for you. Also, any of these, you can visit the website or Instagram page and check in and see if they accept your insurance. I always tell people, if you're looking for mental health and you want something, but you don't want to break the bank, you're trying to stay in your budget, therapy is not designed to stress you out. So if it's costing you too much, that creates stress, and that's not what we want. So utilize your insurance for what it's worth. See if they take your insurance, and you can also call your insurance company. The 1-800 number on the back that we all look at and don't pay attention to. Use that number and call and say, hey, does my plan cover mental health or behavioral health services? And they will tell you exactly how it works. If you have a deductible, what the amount for that deductible is, or if you have a copay, or if you have no copay. So definitely utilize your insurance, because you are paying for it and you want to get the best out of it. And if you're really geared towards this virtual world that seems like we're going to be in for a while. The last two, Ayana and Talkspace, those two are really designed to be completely virtual. And that's a very different experience in therapy than we're used to, but it's something that people are really liking. And if you take a look at those two websites, you can find that Ayana is really designed for minorities and Black people, people of color. So that's a fairly new platform. So I don't believe they're taking insurance completely as of yet. They take a few providers, but they're working their way towards accepting insurance. As far as I know, you pay per session. Talkspace, I believe you is also virtual. They do accept, I believe, Cigna and a couple of others. I want to say TRICARE and some others. But for the most part, you can pay out of pocket for them as well. And you can pay per session or you can do per week, depending on how your sessions roll. Talkspace has a few different payment options that you could pick from to fit your budget and to fit, your time as well. So that's another thing that you really want to look into too when selecting a place to start your therapeutic journey. You want to pick somewhere that you can have some consistency, something that is fitting into your schedule, but also fitting into your budget. So think about those things as well when selecting a great resource. So at this time, I want to open up the floor. If anyone has any questions, you can post them in the chat and we will go from there. Thank you guys for having me and listening in.
So we do have one question in the chat from Ms. Nikita. If you see the warning signs in a child that is not your own, how should one bring it to the attention of a parent caregiver who may not see it? Or if you do speak to the parent and they don't want to accept it, and you've spoken to the child who talks to you more than their parents confiding in you? That's a hard one.
Oh, that's a loaded question, isn't it? So
And I think we've all been there. So I'm excited to hear what you have to say.
I have been there, unfortunately, more than once. But from personal experience, what I have done is I always try to present the facts to the families, let them know exactly what I'm seeing, but also being supportive and letting them know I'm here to help. I think oftentimes families get on the defensive and they feel like we are attacking them or judging them or trying to put them down. And I always try to let families know that that's not the space where I'm operating from. I want to help you so you can help your child and we can work as a team. And oftentimes it takes a little patience and persistence, but oftentimes those families do come around and start to open up a bit, but you just have to break through that barrier. And also, you can't take it personal. You have to remember that, people have defense mechanisms and people put up barriers and walls to prevent you from getting too close so they don't have to be vulnerable. And in order to, get through that, to help this child or this youth, you definitely want to stay patient and persistent and just, again, be supportive, hear them out, be open, but still present them with the facts.
That's such a good question. You had said something about kids being irritated when they're not, they're trying to process a problem,
Mhm.
and they may lash out. I know I've seen that with my little nephew who just moved, and he's 4, all the way to my teenager who's 18. So, what are some of the ways you can help them? Because I felt for him, and I'm not a therapist with my nephew, but I knew he was upset because he moved. He just lashed out, but it was like, how do you help them when you're in that moment with them and they're kicking and screaming and all that?
And I think you raise a great question because it's the in the moment comforting and consoling that is the toughest. And depending on the age, sounds like your nephew is younger. So depending on the age, a lot of times with the younger kids, it's better for us as the adults to not escalate with them, to not raise our voice with them, but to get on eye level with them and let them know, hey, I see that you're upset. When you're ready to talk about it, I will be here to listen. Just let me know and use your words. And a lot of times, kids don't really know how to take it when you say that. Sometimes they look at you like, what do you mean? But it gives them, again, that green light. It gives them the space to say how they feel, and they feel safe. And that's really all they're looking for. And some kids, you have to give them that space to say, hey, I'm here when you want to talk, because they can self-soothe. They just need the space to do it. And if we constantly hound them or constantly ask, how can I help? How can I help? It escalates them sometimes. So sometimes a little space and time can help, a child, calm themselves down. But we haven't left them, and we haven't made them feel like we're not supporting them. Mhm.
That's good. I had myself muted so I wouldn't interrupt you. So I know you work with a lot of kids that are going through issues. What are some of the things, without giving personal details, but what are some of the things that you see presenting in the office?
Um,
Like, I know we've talked
so,
about a lot of the racial issues we've had this year. Like, even
mhm.
though kids may not know everything, they're seeing things on the news, and then maybe the teenagers who do know a lot of what's going on, they're having extensive conversations with their
Mhm.
classmates, maybe with friends. Have you seen anything presenting about that?
Yes. So now that you asked it, I'm thinking a lot of my teens, very, very strong feelings about everything that's going on in the world, from the pandemic to police brutality, and oftentimes if they are in mixed company at school where it's very diverse, it's hard for them to feel comfortable expressing themselves. So therapy is where, they can have that outlet. And for one of my teens in particular, he's a young male, and he's phenomenal student. And of course, like most boys, we do a lot of things. We could be busy, we could be all over the place. So we get in a little trouble here and there. But for the most part, he's a great student, great grades. And he was really struggling with, one, transitioning to virtual learning, and then two, with all the things going on in the world with police brutality. It was textbook. We always say, these things are impacting us, but to see it firsthand and to have a youth come to you with those, it's a very tough pill to swallow. But in supporting him, I just had to give him the safe space to talk it through, and to problem solve is a big one. I think a lot of times, the generation coming up now, problem solving is something they have to be able to do. And we as the adults have to be able to guide that discussion, but also give them the freedom to select their own solutions. As long as their solution is within reason, of course, you know. But if they select a good solution, when we support them, it gives them the confidence to take on another battle, or to take on another, situation that they may face, or if any adversity comes up, it gives them that esteem, that self-esteem, and that strength to push through. And again, with this client in particular, that was a big one, and he and a couple others, even some of my ladies, because a lot of it was focused on men, black men, and with police brutality, a lot of the girls would come to me and say, well, Mr. Sean, I just don't understand, why someone who looks like my dad, or someone who looks like my uncle or my brother, is going through this. And again, giving them the space to talk and just being supportive, and helping them understand how to, problem solve in worst case scenario, so they're prepared and they're equipped, is one of the biggest things, we can do as the adults in their world.
Sean, that's so good. So thinking from the dual hat as a parent, I know a lot of times it's hard. One of the question that we had earlier was, that resistant parent, but sometimes it's hard to process that your kid is having an issue, and to like trust someone else
Hmm.
with them. So how do you, what are some of the things you, because I know the parents are going in there with anxiety about handing their kid over to you as well. What are
Yeah.
some of the things you go over with them?
So a lot of times when we start therapy, we do meet with the parents first, and usually that's the intake. You get the information, you go over the technicalities and all of that good stuff, all the boring stuff. And and then you kind of get into, this is who I am. I let parents, kind of ask me questions or bounce ideas off of me, and create that collaboration with them in the beginning, to let them know, like, I'm not just the therapist who's going to tell you this is what you have to do, A, B, and C, and boom, your child is fixed. I let them know this is a process. This is something you have to be included in. And I would love for you to be included in the planning, in the treatment plan, all of that. And to make them a part of this process, because that is empowering, but also you've created an ally, and the children or child who you're working with can feel like, oh wow, all these adults are here for me, and they're supporting me, and all these adults are saying the same thing. Maybe it's something I should listen to. And again, like you said, parents sometimes are apprehensive, they're a little nervous, but to create that, team is huge in the beginning. And me personally, I can't speak for all therapists, but it's a place of genuine, that you have to be genuine in interacting with families, and you have to be authentic. And for some folks, that's hard to do, even though they're therapists. But being genuine and being authentic is priceless. And it's something that, people can feel, they can sense, and especially kids. Kids are going to call you out. They have no filter. So if you're not genuine and you're not authentic, they're going to let you know. So that's something you have to do in order to not only gain the trust of the children, but to gain the trust of their parents as well.
Yeah, and I'm sure, like you were saying, not every therapist is the same. So you could have had a bad experience with someone,
hmm
and now it's like you're starting over. But I think we all just have to make sure that if it's not working in the beginning, cut it from, I don't know, maybe, what do you think, Sean? 2 or 3. If you see it's not working, it's not a
hmm
good fit, and just find someone else instead of not finishing with therapy. Because I think that, like you said, that genuineness, that connection, kids can definitely feel that, where sometimes we're more superficial.
hmm
Um, so I think we need to make sure that people know that as well. Like, sometimes it doesn't
Yeah,
work, and then you just work with someone else.
this is true. And I always tell families that I work with, you hate to put a number on how many chances you're going to give a person, so to speak. But I tell them, good rule of thumb is to give, a therapist at least a solid month, because that gives you, if you're going weekly, that
Right.
gives you, the first session is the intake. So the child probably won't meet with the therapist. And then that gives the therapist 3 sessions at least, 3 strikes, to try to build a bit of a rapport with this kid, and to see where they can go from there. And sometimes it takes those 3 weeks to build a solid rapport with not only the child or the youth, but the parent. So that's, kind of my gauge. For some people, it's a little different, which is understandable.
Right.
But and some people it's a little shorter. But I think 3 chances, solid month will give you a good picture. And therapists, the very professional therapists, understand if it's not a good fit, and you say to
Right.
them, hey, I'm not feeling it. I appreciate everything you've done, but I would like a referral. Or, I think we're going to try somewhere else.
Right.
We understand that we don't fit everyone. Because if that were the case, everybody would have the perfect therapist on the first try.
Right. And I think with
So
telehealth, that kind of opens it up, where you can maybe think of a therapist that's farther away than usual. So one of
hmm
our Connect with a Therapist resources, Cheryl Maxwell, she's a licensed therapist, and she referred someone who is in this area to someone that was maybe 2 hours out, and they were upset. And I tried to explain to them that, no, well, now with that's one of the good things I think that came out of the pandemic, is more access. Even
hmm
with NAMI, we work together. Really, that telehealth um, initiative, that telehealth legislation opens it up for people to be able to call. Even if you can't have service on your phone, you'll still be able to call and talk to someone, and they can get paid, and it's not out of pocket. So that helps a
exactly.
lot with people getting access to mental health care.
And you are so right. Like, one, major positive out of this pandemic is this virtual world we have. Telehealth has been so helpful for so many people, especially folks in like a rural area or people who have busy schedules where it's like, if I could cut down the commute time, I could get to therapy.
Right.
Sometimes it's literally cutting out that commute and being able to just come straight home from work, hop on the session, and then, do what you got to do afterwards. It makes it so convenient. And that's why, the therapy offices that I had listed, a lot of them aren't in Howard County or Baltimore County. But at the same time, if they're offering virtual, it's something you can definitely take advantage of, and they're quality therapists at those spots.
And kids are more willing and flexible to do therapy on the phone. I know Nia Jones was telling us that they're even, she has to stop them from, like, cut them off, like, no, guys, we really have to wrap it up, because they're more willing, they felt more comfortable sharing that way.
That is so true. I use Doxy. It's a kind of online confidential therapy telehealth platform. And I love it because when I meet with my kids, it has a timer on the left hand side. And if I let them know ahead of time, like, hey, buddy, we have X amount of minutes, they watch the clock. They're like, Mr. Sean, we only have such and such. I have to tell you this and I have to tell you that. And so I've had to learn to give them their space and say, here's X amount of minutes. Let's talk about what you want to talk about. And I break it in half sometimes for some of the kids who really have a lot to say. And then, for the others who aren't as talkative, they still are mindful of the clock and how much time they have. And they make sure they fit whatever they want to talk about into the time.
And that's
They make sure. So it's definitely opened
so
up a lot for us.
let's see. Miss Tania is asking, are you offering telehealth at your location?
Yes. Every therapist at Lighthouse kind of makes their own schedule, and they just kind of let our admin assistant know. And she's really good about keeping up with our schedules, and she can look in virtually. So if you call, not virtually, but she can check it online. And if you
Right.
call in and you say, hey, I'm looking for a therapist, here's my availability, and here's the insurance I have, she can kind of plug you in and let you know who's available and if it's virtual or if it's in person.
Right.
So that is something that, again, like with the world opening up, folks are starting to go back to in person kind of softly, like a soft opening kind of deal. So some therapists have more openings in person, some have more virtual, but yes, there are virtual opportunities.
Okay, that's great. So I know the whole thing with Lighthouse is you do play therapy. So this is like for Ms. Mimi used to say the littles. For
Yes.
the littles, how has that transitioned? Because you're not able to do your play therapy. And could you talk to us about what play therapy is and how you transition with the virtual
Whew.
world with that?
So play therapy virtually is extremely difficult. But I will say it is working, kids enjoy it. We have to kind of do, I don't know if you've kind of seen any kid do virtual school, some of the littles. The teachers will have a virtual classroom and the kids can manipulate it and go in and click apps and open up web pages for activities and things of that sort. That's kind of what play therapy would look like online or doing telehealth. So you can have a Google Classroom and you can let the kid come in. The kid can click if they want to do a coping strategy, they want to do a breathing exercise where it walks it through the deep breathing exercise, or they could play with something that takes their mind off of stress. It's a whole lot of different things you can do. Coloring sheets online, color by number. It's plenty of different things virtually that we do. But traditionally, play therapy is, client centered. The kid is in control of his or her session. We may give a directive at the beginning to say, hey, this is the activity we're doing.
Okay.
Or we can go in and let them do free play and see where they take us. A lot of times if we do free play, we set up the space to give them the things that we would want them to lean towards, but we're not going to force them to do anything one way or the other, whether it's a directive or non-directive. And A lot of times too, depending on the age of the kid, they could potentially do sand tray. A sand tray session is very unique, but also very powerful. And
When you say a sand tray, do you mean like the one
mhm.
where you put the rake in the
you
little
can
plate?
you can use that one. Typically
Uh-oh.
for kids,
That
we
sounds
have a
messy.
right. So that's why I said depending on the age and if they can handle it. But depending on the kid, I know at Lighthouse, Mimi has a large sand tray, and she uses Jurassic sand, which is hypoallergenic, and it's always pretty much the same temperature. It's pretty cool
Okay.
to the touch. So again, to kind of feed into the sensory needs of certain kids. And a lot of them, even the ones who don't have sensory issues or needs, they'll say, Mr. Sean, this is cold. Is this cold? Was it wet? I'm like, no, buddy, it's not cold. It's not wet, but it stays that same temperature. And I can't tell you how.
Right.
But we allow them to manipulate the sand if they want to put their hands in it or if they want to tell a story. We let them use their hands, but also using miniatures. And usually those miniatures are symbolic and they tell us what they
Okay.
mean in the midst of their story. So you may have a kid put a circle with their finger in the sand. They might put a little character in the middle. Let's say when Inside Out came out, this was really popular. They put sadness in the middle. Hopefully, people have seen that movie. They put
That
sadness
is
in the
a
middle.
great movie,
It's
a resource
phenomenal.
movie.
Yeah. And they put sadness in the middle of that circle. And some kids will say, that's it. And
Oh,
most people probably look at that and be like, what in the world does this mean? But it's not to us
right.
to establish that. It's up to the kids. So you ask them, what masterpiece have you created? Or what's in your sand trade story? Can you tell us about it? And they kind of light up and they're like, oh wow, I get to talk about me. And then they tell you, why they put sadness in the middle, if that's them, and what the circle means, and who's outside of it, who can come in, and things of that sort. So that's just one example, and of course, certain kids, the tray kind of can get filled up really quickly.
Yeah.
So the story gets really long, but so that's kind of a sand tray session in a nutshell, just to sum it up. But the symbolism and the power of the storytelling is where the therapy comes from and where the healing comes from.
Thank you, Sean, because I know
Mhm.
a lot of people when you're you're thinking about therapy for a little kid, you're like, well, what are they going to be doing? That's just a waste of money, but it's
Right.
actually science behind it, and you're
Definitely.
addressing their issue. And like, I mean, I think for so long in our community, you just hear kids don't have anything to be upset about, or
Hmm.
there should just be just some of the things about them not having those feelings of being upset or emotions of being angry about
Yes.
a separation or whatever it is. It's like that's good that we're in a space now where they're able to get help earlier and not be broken people.
Exactly. Exactly. And I think too, for parents to realize it and start to bring their kids is a huge thing too. I didn't realize how many kids were actually coming to therapy until I started working at Lighthouse.
Wow.
It kind of opened my eyes to see like, wow, parents are kind of getting hip to this. Like they're coming in, they're bringing their kids, and they're active participants. You know, so
Yeah.
it's a really good thing to see, and I hope it just keeps getting better from here.
Yes, so thank you, Sean. I know when we had talked on the phone, I joked with you that you were a black unicorn. When people are trying to find therapists, they're calling and they're saying, my young son, my teenage son, I want a male therapist. So it's nice that to put a face with a therapist that's doing good work and dealing with these heavy topics, and is culturally affirming, that can connect with them and really help
Hmm.
them to get in a space of problem solving, which you said that's like the power that we're giving them to really deal with situations. So that's a great thing for us to be able to see in action. I don't see any questions on Facebook. I'm just trying to make sure that we address any questions that are out there. And I don't see any. I did put all the resources that we talked about in the chat. Well, I also went over and did So let's see. I also shared our youth resource link and our Instagram. Do you have an Instagram that you're can you put it in the chat, the for your journaling that
Sure,
you said?
yes.
Yeah, so that way people can directly connect with you. So we appreciate you so much for coming out. I just wanted to also let people know that our next Mind Health Shop Talk, it's always the third Tuesday of the month, and this one will be June 15th. And it's a little bit before Juneteenth. So hopefully I'll be able to send out some information on what we're working on for Juneteenth. But the Mind Health Shop Talk registration link is in the chat. And then also, when you're finished, if you enjoyed Sean and you appreciate having someone who looks like us and understands our issues and is working in the field, and you want to give him a thumbs up for him to come back, I want you to fill out the survey. If you think he was prepared and everything, please fill out the survey. That helps Kaiser know what you would want. If you want to suggest different topics, you can also put that in there. Oh, someone put, let's see, who put thumbs up? Jamila put thumbs up for you, Sean.
Thank you guys. Thank you for having me. I
And
appreciate it so much.
our intern, Shania, said it's very informative. Ms. Nisha Jones, she said thumbs up to you as well. Ms. Vashita, thank you. So you already have good positive feedback.
I appreciate it so much. And I'm glad people came out. I appreciate you guys coming to support. Mental health is so important, especially in our
Yes.
community.
And then, we have, okay, sorry. My mom is a therapist. Therefore, there is a time when a therapist and a mother collide. So do you have any advice for parents who are therapists and have children with mental health concerns?
Wow, that is a great question. Um, that is a tough one, though, I will say, because that's up to mom to take her therapist hat off and be
Yeah.
mom. You know, mom really has to step outside of that role. But once you feel that tension, be okay with saying, I need a break from this conversation.
Yeah.
Can we revisit it when we're both calm? I'd appreciate it if we could do that. Or I need X amount of time to calm down. You know, any of those could work. And again, you know, I know moms can be pushy sometimes. Mom's like, no, we're talking now. But
I am pushy. So we're gonna
but
deal
it
with it
is
now.
but it's important to, you know, respect people's space, you know,
Yeah.
again to give that, you know, time to calm down is
And
important.
also, we need to, like, parents need time to calm down, because sometimes we're at 100 when we walk in
Exactly.
this situation.
Exactly. That is so true.
So just give yourself time, even if you're a therapist and you can say time out. And I think, like, even parents, like when my son is at 100, I think when he says, you know what, I'm not talking to you right now. And I'll be like, what?
Mhm.
Yeah, you're too upset. And I'll be like, I'm not upset. And then I have to think about it like, yes, I am upset. I
Yeah.
probably need to walk away from him. So it's a good reminder.
Mm-hmm. It's like, let me take a minute. You're right.
Right. Because if you're a therapist, I feel like you would have that awareness to be like, wait, I do need to just walk away from this right now.
And it's something we have to practice. Because again, you know, even therapists, we're human, we slip up.
Right.
And we have to be able to say, you know what, you're right. I'm sorry. I apologize. I'm going to take a minute. We can reconvene later.
Right. And you may have the right answer, but if the person's not ready for it, it doesn't matter. They're not receiving it. So it's like, it's
That
just
part.
better
That
to
is
just
so
walk
true.
away and yeah.
That is so true.
Well, thank you, everyone. Miss Taylor said, great job and information, Mr. Baker. So guess what, Sean, whether you know it or not, you're going to be back at some other point in time.
Oh, I am looking forward to it. This was phenomenal. I enjoyed it so much.
Yes, yes, yes. So thank you. I think in Mental Health Awareness Month, this was a good fit because I don't think we talk enough about young people's mental health. Hopefully, with all the issues with the pandemic, the co-pandemics with the racial injustice and COVID-19, this will make us all think about our young people more, our littles, as Ms. Mimi likes to say as well. So I just want to thank everyone. Have a great evening. And we hope to see you at the next Mind Health Shop Talk. Take care. Bye.
Take care, guys.